Hey everyone, this is Greenfeet Medical's Medic Minute with Ben. Today we're going to go over a simple pressure dressing. Alright, so you've finished wound packing, you've controlled the bleed, now it's time to put a pressure dressing on. For a pressure dressing you can use any sort of elastic bandage, ACE wrap, emergency trauma dressing. Today I'll show you with a 4-inch emergency bandage, also known as an Israeli. And to do that you're going to hold pressure on your wound pack here still, and if I've done a good job controlling bleeding with good wound packing technique, you're not going to have to get this tourniquet tight or attempt to get as tight as possible, just snug to hold that in place. But if you've done a poor job wound packing, or it's a really difficult wound pack and it's still rebleeding and you don't have any more supplies to wound pack, then this is the time you can use this. Try to get this as tight as possible, kind of like the Hail Mary. But otherwise, getting it snug should be plenty. Now, for this one in particular, you're going to put the plastic over your nub, and the key to good bandaging is keeping this nice and wide. Alright? I see a lot of people rushing through this. I'm going to pull tension here, but I'm keeping it as wide as possible in good bandaging. I'm going to go through this U-shaped clip, pull. You pull a little and you pull tension, alright? Going around. Now if you want, and I needed more pressure, I'd go through the U-shaped clip after 2 wraps and pull back, and it'll put pressure directly down that nub. If I didn't need that, you could just keep wrapping. Now, if for example some gauze was poking out here like that, treat that similar to a tourniquet tail. We want to make sure that's covered up, because if it gets caught on anything, it could really pull out and yank out all our hard work there. So I'm going to keep wrapping this, getting it snug, keeping it as wide as possible as I do it. And as we get to the end, you'll see you've got these little alligator clips right here. You'll just take that, find a strand here, put it through. Same thing for this side as well. Little strand there, put it through. But I'll be perfectly honest with you, if I'm going to move a patient, that is not as secure as I'd like. This is why I carry flat pack duct tape with me. So I'll take my duct tape, and I'll go one wrap around to really make sure this thing's staying in place. I always dog ear the end of my duct tape. And even then, I'm going to reassess every time I move this patient to make sure this pressure dressing is still working and it's not rebleeding. That in a nutshell is how to do a simple pressure dressing with good bandaging.